Hello, my name is Sam Feltham, and welcome to Expert Interviews on Smash the Fat. With me today is Assistant Professor at the University of South Florida College of Medicine, Molecular Pharmacology and Physiology, Dominic D'Agostino. How you doing, Dom?
Great, Sam. Thanks for having me.
No worries, it's a real pleasure to have you here, because I kind of came across your work firstly probably about 3-4 months ago with your TEDx talk, where you started off the talk talking about all the work that you did with, was it the Navy SEALs that you're working with, who were sometimes suffering from seizures due to deep sea diving, and then you sort of came up with a protocol for them to follow to try and stop those. Was that right?
Yeah, the Office of Navy Research kind of sponsors our research, and it's directed towards the Navy SEALs and those that use high concentrations of oxygen for their dive operations. And we want to figure out why the problem of seizures exists, and to fundamentally understand that and to develop a mitigation strategy to prevent the seizures and enhance the warfighter performance under environmental extremes. That was kind of what's kicked off, a lot of the research that I'm doing now is spawned off of that. Yeah.
Perfect. So how did you kind of get to that place where, you were a PhD, and then was your PhD kind of related to that, or how did that develop?
Yeah, my PhD I did at Rutgers University in New Jersey, and my PhD focused on low levels of oxygen, hypoxia, and specifically I studied the neural control of autonomic regulation. So kind of how our brain controls our physiology, specifically our heart rate and our respiration, so how the brain controls that. And I guess more specifically, how the level of oxygen in the brain controls the cardiovascular and respiratory functions, and how brain cells that we call neurons modulate these autonomic regulations. So that gave me the understanding of neuroscience and also the physiology, right? And cardiorespiratory physiology. And I chose to do my postdoctoral fellowship under Professor Jay Dean, and his focus was, more military-oriented and understanding, the effects of high concentrations of oxygen on the brain. So I went from understanding, the problems with low oxygen, which could be altitude, stroke, ischemia, things like that, where the brain is starved of oxygen, to too much oxygen. And in the process of going on to my postdoctoral work, to better understand what happens to the brain under high concentrations of oxygen, we built specific equipment to look fundamentally at cells. And we looked at a variety of cell types under high levels of oxygen, including cancer cells. And we observed that cancer cells kind of don't like high levels of oxygen. They actually thrive in lower levels of oxygen. And that more or less spun off into our cancer research that we're doing now. But like I said, the high concentrations of oxygen can cause seizures in Navy SEAL divers, and I kind of stumbled upon the therapy of the ketogenic diet through the Charlie Foundation, which is started by Jim Abrams, a Hollywood producer, and I've met Jim several times, and he runs a wonderful foundation and helps many parents and kids with epilepsy. And I stumbled upon his foundation, and then I saw that there was a lot of literature definitively showing that nutritional ketosis is a very powerful neuroprotective strategy against seizures. And independent of the etiology of the seizure, almost independent of the cause, it seemed to work for the majority of almost all seizures. And even when drugs fail, the ketogenic diet works. So I became fascinated with that, and I wanted to understand how brain metabolism is changed just simply through nutrition, through elevating blood ketone levels. And these ketone bodies seem to impart a neuroprotective effect not only do they give the brain a new source of energy, but the ketone molecules tend to alter brain signaling in a way that is very neuroprotective. So a big chunk of my research time now is understanding fundamentally how ketones alter the metabolism of the brain. And that has led also to studying cancer, because cancer cells really run primarily off glucose as their main energy source, and due to defects in their metabolism, they cannot effectively utilize ketone bodies as a source of energy like your healthy cells can. So we can develop metabolic strategies or therapies to exploit that metabolic deficiency of cancer cells. And we can do that with a variety of different elegant, combinations of high oxygen, specific diets with macronutrient profiles that produce nutritional ketosis, and the addition of ketone supplementation, and even with various cofactors. And that's all completely non-toxic. So the idea is not to, is to develop a therapy that can be an alternative to the standard of care, which is toxic chemotherapy and radiation, which can be, obviously
it's pretty demanding. I mean, I myself, I don't think I told you, I had Hodgkin's disease when I was 13, so I had 4.5 months of chemo myself, and I can tell you it's horrendous. It's not nice. So yeah, I would have loved to have had maybe the ketogenic at least alongside of it, maybe, and then it could have maybe gone in like 2 months instead of like the 4.5 months that I had to go through. But yeah, we've got to try and sort of look into that more and more. But for everyone that is kind of new, because a lot of our listeners and viewers would have heard about the ketogenic diet before, and they might even be following a ketogenic diet as we speak. But for anybody that's new, can you tell us sort of what is ketosis, and why would we maybe not want to run just on glucose?
Okay, probably the simplest way to start off is just by kind of saying what you already know. If you eat a normal diet, your brain is primarily running off glucose, and as you if you stop eating, we mobilize fatty acids from our adipose tissue for fuel. And your body loves to burn fat. The heart actually runs extremely efficiently off fatty acids for fuel, as do muscle cells. But your brain really cannot gain access to fatty acids for fuel because the blood-brain barrier prevents a lot of, the majority of fatty acids from crossing. And so fatty acids are not a real good source for brain energy metabolism. In the face of starvation, what the body does is the liver converts through beta oxidation fatty acids to ketone molecules through ketogenesis. And the ketogenesis, the conversion of fatty acids to ketones, is really driven by the suppression of glucose, but also the suppression of insulin. And after you've depleted the majority of your carbohydrate stores in the liver, your liver will start producing these ketone bodies, and ketones are a wonderful source of energy, for your brain. But they're normally only seen under extreme conditions, like in starvation or extreme carbohydrate restriction, or in the clinical pathology known as diabetic ketoacidosis, which occurs in the absence of insulin. So a type 1 diabetic will need to use insulin because their body is not producing it. So if your body doesn't have insulin, you have runaway ketogenesis. Your liver pumps out massive amounts of ketones, and your blood glucose is high. So you
at the same time,
so the real problem actually occurs with the high glucose and the ketones together. It's actually the high glucose is more of a problem. It exacerbates the acidosis. So you have, it's important to understand ketosis. You have starvation ketosis, and then you have diabetic ketoacidosis. But with carbohydrate restriction, you have what we call healthy nutritional ketosis,
Mm-hmm.
where you're given your body the macronutrients that it can use for energy, including fats and protein for growth and recovery, but the carbohydrate restriction reduces the level of insulin to allow the body to naturally produce ketone bodies as a source of energy. And we know that ketones can be a great source for the heart and the brain, and they have they have a lot of interesting properties from a signaling standpoint. So they can improve cellular signaling and kind of enhance antioxidant processes that can protect the cells. And
Right.
that's our lab is really delving into all the mechanisms there. So if someone wants to if someone's on a ketogenic diet, my definition of a ketogenic diet is one that elevates blood ketone levels or urine ketone levels. There's kind of like there's information out there. A lot of people say they're on a ketogenic diet, but they're actually on a high protein, low carb diet. And if your protein is if your protein is really high, it won't effectively get you into the ketosis that you need to be in. And I would not advocate that everyone go on a ketogenic diet, but I know from my standpoint that it can be a very effective tool for weight loss, as the Atkins diet has been for many people. And it can be an extremely effective tool to metabolically manage a chronic neurological disease or even cancer. And so the ketogenic diet, I think, is kind of like the baseline metabolic therapy. So what our lab is interested in doing is further defining what's the optimal ketogenic diet, and also developing various forms of ketone supplementation, so we can exploit the metabolic benefits of ketones. And that can help, for example, if someone has cancer, can help someone maintain a low glucose level and comfortably, so they can comfortably stay in a mild hypoglycemic state and have asymptomatic for hypoglycemia and feel lots of energy, feel completely neurologically together.
Sound,
Yeah, so the best book, a lot of people ask me, well, they don't even know what the ketogenic diet is, and they say, well, am I on a ketogenic? I eat lots of pasta, that's high in protein, right? And I was like, whoa, you really, I mean, there's a lot of people who just hear about this and they just have no idea what it is. And I think the books that I recommend that people seek out to give them a foundation of knowledge to determine if this approach is for them, or maybe for a loved one who has, type 2 diabetes or obesity or even seizures or cancer, is The Art and Science of Low Carbohydrate Living by Jeff Volek. And Jeff Volek has really been one of the go-to guys in putting the information out there that's real easy to understand. For more performance-based, people, The Art and Science of Low Carbohydrate Performance is an excellent book. And these are books that I like are mandatory for my students that come into the lab. And that gives them, it's written in an educated layman's terms. So if you're someone completely with no science background, you can get the gist of it. And there's recipes in it. It's a very user-friendly book. And it's also written at the level that's referenced, so you can bring it to your doctor. And if your doctor is like, you can't be on a high-fat diet, it's going to be atherogenic and cause cardiovascular problems. Well, no, here is the science to say that that's not true. But I think I'm really big advocate of self-experimentation. And I think people really need to find out where their carbohydrate threshold is and to optimize the level of carbohydrates in their diet. So I'm a pretty sedentary person. I'm behind a desk a lot, and I try to exercise when I can. So when I was more of an athlete, I guess when I was younger and doing a lot of physical labor outside, working outside, my carbohydrate needs or tolerance was much higher, and I grew up on pasta, and that was great, and I was fine, and I didn't get fat or anything. I did burn it off. But the majority of people are not super active enough to really live a healthy lifestyle and have good metabolic health, eating a diet that's 70% carbohydrates, they will tend to overeat, and hence you get metabolic syndrome. So simple carbohydrate restriction and replacing that with healthy fats and protein it's a big hammer. It can go a long way in improving someone's metabolic health, which in the long run can really prevent the early onset of chronic diseases like things like Alzheimer's, Parkinson's, cancer, a variety of things can be exacerbated if you don't have your metabolic health, which is your lipid profile and your blood glucose in check. And these things really go awry, and it seems to be it depends on the person, but 40s, 50s, 60s, you see a kind of a downward trend and a more unfavorable metabolic profile, lipid profile with age over time. And that's why it's really, and I think as we get older, it's really important to implement some kind of carbohydrate restriction if we're not an advanced athlete.
Yeah, absolutely. And that's something that we advocate, and we basically do kind of a similar Atkins thing where we try and get people into ketosis within like their first month of changing their diet, and then slowly but surely bring in certain carbohydrates, starting off with fruit, kind of just berries and cherries, and then do that for a couple of weeks, and then after a couple of weeks of doing that, sort of experimenting with it, and then bringing back a little bit of starch, kind of specifically the resistant starches and things like that. I don't know your opinion on resistant starch. Have you got an opinion on the resistant starch stuff?
I think it can be an effective tool for people, and I think there's a variety of different carbohydrate sources out there, fibers, soluble fibers that are pretty good for gut health, and that can play an important role for keeping blood glucose elevated and in check and preventing insulin spikes and things like that. I tend to take the approach of kind of just titrating in vegetables, and I do get in. I'm actually really carbohydrate tolerant. So even though I kind of follow a mild ketogenic diet, and occasionally if I'm traveling or just for my personal interest, I'll do like 2 or 3 weeks of pretty strict ketosis. But otherwise, I just kind of follow a pretty lax ketogenic diet. And every day I have some form of chocolate. I probably have a quarter to a half cup of berries. And I like raw veggies, lots of salads and fish, and chicken and nuts and things like that. So
absolutely. So it's kind of like a cyclical ketogenic diet almost, would you say, or?
I do. It depends on my activity level and what I'm doing.
It's precisely.
If last week I was traveling in Puerto Rico and being active a lot outside, and I like Quest bars, Quest Nutrition. They make a protein bar, and it has a kind of a soluble fiber in it. And if I'm traveling a lot, I will bring them with me, and I probably have 2 of them a day. And that's kind of it's a low carb bar, but that's kind of a lot of carbs for me, actually, if I'm getting like 2 or 3 of them in a day. If I'm more active. So I eat differently depending on where I'm at and what I'm doing, but I know my metabolism, and over time I think it's good to try different, to keep metabolic flexibility, and and I think even doing a short-term fast is a good idea, and just to experiment.
Absolutely. That's kind of part of our program. We try and get people to chuck in, like we start them off with just a 16-hour fast just to start with, and then increase it. Maximum is 24 hours, but we kind of do it so that we chuck it in there, for metabolic health specifically, not because of lack of calories per se or anything, but more about the metabolic health, and having that metabolic flexibility, which is a great phrase, in fact, for it. So in terms of the actual work that you're doing to kind of prove its clinical application in cancer treatment, what specifically are you guys doing in the lab right now?
We have a number of projects going on right now. The project that's probably at the top is funded by the Department of Defense, which is part of the Office of Navy Research. And what we do is develop ketone supplements in the form of ketone esters. And these can be given independent of carbohydrate restriction and given to a person that's eating even a high carbohydrate diet. And it can quickly, rapidly elevate blood ketones and sustain blood ketones for many hours. So we're looking into the neurological effects of this, and also the effects on the physiology and the metabolism as a whole. So we're looking at brain metabolism, and we're looking at how it influences blood glucose and other metabolites in the blood. And we're using a technique called metabolics, where we can look at thousands, up to 3,000 different metabolites in the blood and also in the brain tissue. So we're at the point now where we're looking at different ketone supplements and their effects, their neuroprotective effects. That's one study. As it relates to seizures and cognitive resilience, I guess you would say, under environmental extremes, whether it's high oxygen or low oxygen at altitude.
Right.
And we're doing a study, several studies with cancer, where we're looking at glycemic agents like metformin, dichloroacetate, and that's a study in and of itself. And we're finding, we're looking to identify the optimal dose of these agents that influence metabolism, cancer metabolism, and we want to add them to some of the studies we've already done. We've demonstrated that the ketogenic diet with hyperbaric oxygen therapy together is a very powerful suppressor of tumor growth and can extend the survival of animals that have aggressive metastatic cancer. So we think of that as kind of like a base therapy. The diet alone has been shown by groups like Adrian Schecht's lab at Barrow Neurological Institute, Tom Seifert's lab at Boston College. So we didn't want to reproduce what other people have already done, so we took the ketogenic diet and added it to hyperbaric oxygen. And we want to determine the optimal level of oxygen that can reverse the tumor hypoxia that can that typically drives a lot of the signaling processes that enhance tumor growth are driven by hypoxia. So hyperoxygenating tumor tissue is a way to reduce various signaling pathways called HIF-1 alpha, VEGF that drive tumor growth.
And how is that actually applied as well? How's that sort of given?
Well, we have chambers in the lab that are hyperbaric oxygen therapy chambers. So we do this in an animal model where we can put like 6 of them in a chamber, or even 12. And then, of course, I get feedback from patients who read some of the science, and then they go and try to implement it themselves when they're not really, their doctor doesn't really know about this therapy, and it's not something that's really dangerous. A diet therapy combined with oxygen, and it's relatively safe. It's been around for a long time. So we don't run human clinical trials here with cancer. We have a couple other contracts that we do with ketogenic diets in humans, but the feedback that I'm getting is suggesting that that this is very positive, and it just mimics the science that we know.
In the animal models.
In the animal models, and we're, like other models, we're looking at Angelman syndrome. It's kind of there's a seizure disorder associated with this neurological disorder, and the ketogenic diet can be effective for that. ALS, we're testing the Deanna protocol, which Deanna is an ALS patient that actually lives in Florida, and she responded very well to a metabolic therapy which uses a variety of supplements, including arginine, alpha-ketoglutarate, and various cofactors. And when there's really nothing available for ALS patients, the father of Deanna stumbled across a supplement, various supplements that provide energy to the cells that are dying of glutamate excitotoxicity. And this therapy caught my attention, and we were able to test this in mouse models of ALS. And when very few things extend survival or improve motor function in ALS mouse models, we found that something as simple as feeding various energy intermediates and cofactors can enhance the survival in ALS. Alzheimer's disease is something that we study too. We collaborated with a lab that did a study in a mouse model and showed significantly improved motor function. And that has inspired a clinical trial at our university where it's a double-blind, placebo-controlled human clinical trial using MCT oil combined with coconut oil.
Actually. Oh, amazing. Yeah. I can see your MCT oil in the background, Dom.
Oh, yeah? Yeah. So we used a lot of that in the lab, actually. When we test various ketone supplements, we usually test it against various natural derivatives, MCT oil, and so it's good to. MCT oil is great, actually. I mean, it's cheap.
It's a real good thing that you can.
You can cook with it. You can, put it in salad. You can incorporate it into food. And in our hands, it's a very good ketogenic agent. So the only problem is a lot of people, there are some people that can take even as small as a teaspoon of MCT and have a major gastrointestinal problem with it. But I find that's about 10 to 20% of people. So it's a minority, but it's a consideration. When you try MCT, I tell people not to try 3 tablespoons at once, but to really ease into it. And for me, I can tolerate a lot, and I think I build a tolerance to high levels of MCT over time, so I can incorporate a lot of it.
Just chug down a whole bottle.
Yeah.
So in terms of the ketogenic diet, along with the hyperbaric oxygen therapy, are there any particular cancers that it's particularly effective on, or is it kind of the whole lot?
Yeah, that's a question we don't really know at this time, but I think it's safe to say that if someone has a cancer that's really hot on a PET scan, which means that it has elevated glucose consumption and it's outcompeting the healthy tissue for glucose, the tumor cells are highly glycolytic, we say, and they have high expression levels of insulin receptors on the membrane, and so the ketogenic diet will limit glucose availability to the tumor tissue, and it will also suppress insulin, which will could facilitate glucose transport into the tumor. So simply by suppressing glucose and suppressing insulin, you're compromising the growth and proliferation of the tumor. And that can, in and of itself, be pretty effective. And it can also weaken the cancer and compromise its its health state or its viability in the face of other modalities that you put on top of it. So if you compromise tumor metabolism and then hyperoxygenate it, the elevation of oxygen within the tumor, which could be 10 times higher with hyperbaric oxygen, will trigger an overproduction of oxygen-free radicals, which can cause cell death, and it overwhelms the antioxidant capacity of the tumor tissue.
Right.
And because tumor cells, thrive in a low oxygen environment, when you hyperoxygenate them, it becomes sort of toxic to the tumor cells, and it kicks off things like that can drive tumor growth. So the combination of those two together, I think, would be effective, in particular to tumors that are very visible and hot on a PET scan. Tumors that are highly glycolytic. So the tumors, things like brain tumors, glioblastoma, I think would be very responsive. We know there's been case reports and studies on brain tumors and
it's been quite a few actually. Haven't there quite a few case studies where it's kind of really reduced the size of the tumor? So
this could, I think ultimately we can go into the direction of a non-toxic therapy for the metabolic management of tumor tissues, but I'm not completely against the standard of care, toxic chemotherapy.
Mm.
Because in some cases and in some cancers, for example, leukemia, some types of lymphomas, can be pretty responsive to the existing standard of care, the chemotherapy. But when we talk about brain tumors, advanced metastatic cancer, or solid tumor metastatic cancer, there's really not a lot of, the standard of care is not going to do much for these. It does very little, actually. So I think at the very least it's best to start with a simple metabolic therapy, like carbohydrate restriction, and then ease into, if you push your body into nutritional ketosis, that changes your whole physiology to compromise tumor growth. And if I know people in this situation, and they are using it to metabolically manage their situation, their cancer, and some of them are, incorporating other drugs on top of it, different immune-based therapies, which I think have a lot of potential. We don't study them, but I think that these approaches can be complementary and even synergistic with some of the existing things out there and things that are in the pipeline.
Fascinating. Talking about the pipeline, where do you see this leading? Do you see this becoming sort of conventional treatment to go alongside some of the current standard of care?
Yeah, I think things are moving in that direction. It's going to be slow.
Always.
I don't want to get myself in too much trouble, but cancer is really a profit-driven industry, and if we were to discover a cure for cancer today, a lot of people would lose their jobs. A lot of major universities would lose their funding. It would make a lot of people unhappy. Unfortunately, that's really terrible to say, but that's the reality, right? Yeah. So pharmaceutical companies are really thriving off developing drugs for these things. And that's not going to change, not anytime soon. But what I do think there's going to be a gradual shift, because things like the Cancer Genome Project has not really yielded anything that can significantly benefit, patients with advanced metastatic cancer. Some of the technologies and different screening techniques have evolved out of the genetic studies that are being done, but targeting cancer as a genetic disease is not really going to be fruitful in my estimation. I think looking at the disease as a metabolic disease will change our way of treatment and preventing cancer. And I think that will be there's more big people at the top. The National Cancer Institute invited me to a workshop where I gave presentation on this, and it's something that's on the radar of something like the NCI is actually considering the ketogenic diet. And if you just get on clinicaltrials.gov, 2 years ago there might have been 2 trials, but now there's at least a dozen trials on the ketogenic diet and cancer. So there's really been an explosion of research, and these are trials that I don't know where they're getting their funding from, but it's not government funding. But the motivation is so high that people are private agencies and donors are putting up the money to run these trials. Wow. And so you get basically zero interest, 5 years ago when I got into this, to if you jump on clinicaltrials.gov now and just put in ketogenic diet and cancer, you get at least 10 to 12 clinical trials that are actively recruiting people. So this is an indication to me that it's being put on the radar of major universities. So ultimately, in process now are multi-center trials that are being developed. But you get, logistically, it's very hard to run these kinds of trials. To change someone's diet is changing their mindset, their lifestyle. And the IRB, the Institutional Review Board, which needs to approve clinical trials, are very resistant to approve a trial that pushes someone away from conventional care and uses this kind of what they perceive as an alternative approach that is even many review boards actually think it's a dangerous diet because it's very high in saturated fat, or can be. So you get, not only you have the problem with funding, you have the problem with the Institutional Review Board, and you have the problem too that the clinicians and oncologists, they're really not trained in nutrition. You know, I teach at the medical college here. I teach medical students here, and I try to incorporate nutrition into what I teach them. But there is no simple course in just basic nutrition for an MD. And the students want it. The medical students love it, but it's not on their medical boards. So the curriculum development committees of universities are not going to make medical students understand nutritional biochemistry or nutritional physiology, because it's not, they don't need to know it to pass their board scores, you know, their board exams. So it's really important to wedge it in there as an educator. And I think it's really, in my position, I have the opportunity to really kind of indoctrinate young medical students into this philosophy of using food as medicine. And I feel an obligation to do that, and I'm hoping that my students, when they go on and teach medical students, will do the same. And a number of collaborators that, you know, I'm in contact with are also doing the same. So I see a gradual push into this direction, and it's getting good media attention. I mean, when I got into this 4 years ago, 5 years ago, it was not known much, but I think our lab and several other labs have done a good job at getting public interest in this. And I think it's really the human clinical trials that are being run now. Once that data comes out and people are aware that this is a metabolic therapy that they can implement themselves, that they have control sort of over their destiny and over their health, I think that will create more enthusiasm for this approach and more support from academia and from clinical circles. So I see that's my optimistic view of the future, is that that will catch on eventually. And I'm here to do everything I possibly can to do the science and to validate these approaches, but to let people know that this is a viable option that they can pursue if they want to.
Yeah, they can certainly sort of implement it into sort of part of their current treatment, basically. And sort of, I mean, I'd encourage people that are going through cancer treatment as we speak, obviously to speak to their doctor about it, and, you know, as long as your doctor's kind of open-minded, they can even help you kind of track your blood and things like that, so you know exactly where you are with everything in terms of your glucose levels, your ketone levels, and everything like that. And then in regard to talking about ketone and glucose levels, we do have one question from Alex Hayden, who asks, I am interested in the topic of recommended ranges of blood glucose to ketone ratios for long-term management of brain tumours. Is a ratio of 1 reasonable to expect over the long term, especially if the patient is at a lower end of healthy BMI?
Yeah, that's a great question. So the lower end of a healthy BMI would be like 19 or 20. In that case, I would advise, you know, and this is not medical advice, so there's, you know, I would advise that the patient, that someone in that situation is not calorie restricted, that they do, that they maintain their body weight and maybe try to increase it with a little extra protein relative to what a standard ketogenic diet would be. But I would recommend, if they want to implement this approach, to go to a website like the Charlie Foundation, or Ellen Davis has written a great book called The Ketogenic Diet for Cancer on her ketogenic diet resource website. And Miriam Kalamian has also written a book on diettherapies.com. And there are 2 books that really talk about this issue, about the ketone and glucose ratios, and how to set up the diet to titrate in the macronutrients and the calories to hit the proper glucose and ketone ratios. The Charlie Foundation diet is really good. It kind of sets you up with the ratios that you need, the 3-to-1 to 4-to-1 ketogenic diet. It has recipes in there, you know, chocolate brownie recipes. There's a variety of, there's things like that are available, and the keto calculator, by Beth Zupak Kania, who works for the Charlie Foundation. She's the head dietitian, has really done a great job. With the keto calculator, you can basically design a diet that will put you into nutritional ketosis independent of the calorie restriction to hit that proper glucose and ketone ratio. I would also stress to make it easier to use some form of ketone supplementation. MCT oil is fantastic, it's cheap, and if you can tolerate it, use as much as you can within reason. And there's another product out there called Keto Force. It's a pure ketone product, a ketone salt, mineral salt. And if that's mixed in with the MCT, it's a fantastic way to suppress blood glucose and elevate ketones. So I find personally, I use it for more exercise performance, energy supplement, but I find that I can eat just a moderately restricted carbohydrates, like 50 to 100 grams a day, I can get, which is fine. It provides chocolate, some blueberries, and plenty of salads and vegetables. And if I add ketone supplementation in the form of medium-chain triglycerides, or Keto Force supplement sold by Prototype Nutrition, that using these ketone supplements, I can easily put my glucose at the level of my ketones and maintain that 1-to-1 ratio. And it's at that ratio where I really feel lucid. I feel most energetic because my body has adapted to that. So if you're like a newbie coming into this and you put your body into ketosis, your brain, it takes a while for your brain to really acclimate to using ketones over glucose. So you may feel a little sluggish. Even your exercise performance, if you exercise, may be decreased initially. Yeah. But once you become adapted to it, you will feel best, I think, in nutritional ketosis. And one of the practical benefits is that you just don't get hungry, or your mind's not preoccupied with food. So you have sustained energy because you're mobilizing fat. We all have body fat. Even lean people have body fat that they're mobilizing for energy. And we have better access to that stored energy when we're in nutritional ketosis and our insulin is low. So we mobilize fatty acids much more efficiently for energy and use them more efficiently as a source of energy relative to glucose. If we're really strictly adapted to a glucose carbohydrate-based diet, we're going to get hungry, and that
quickly.
That glucose withdrawal that the brain goes through is very uncomfortable, and it produces a dysphoria, if you will. You feel unwell, and if you restrict calories, it really helps people to be in ketosis, nutritional ketosis, if they restrict calories, because they're already kind of going towards ketosis, and if you're on a high carbohydrate diet and you restrict calories, your blood glucose is going to go up and down, and you're going to have these intermittent periods of hypoglycemia that's going to be uncomfortable. It can lead to binge eating. It can lead to an unhealthy preoccupation with food, I find. Not everybody, but some people, that's the case. So getting back to your original question, I got off on a tangent, but I think you can follow just a moderately restricted carbohydrate diet and add ketone supplementation and hit those glucose to ketone ratios of 1 and be within that.
Perfect. And your top sort of nutritional ketosis supplement would be MCT oil.
I think MCT oil and the new product that came out called Keto Force is pretty potent, and I think there'll probably be a powdered version coming out in the future.
And, cool, kind of like a Gatorade.
yeah. Right now, it's a true prototype product. That's actually the company that sells it, and it tastes
funny.
Kind of bad, but you can sweeten it with something like stevia, and you can actually make it taste good if you dilute it. The product comes concentrated, and then you add it to whatever drink you want to do. But I can tell you that it's a very powerful appetite suppressant, because ketones just tend to dampen your appetite, and it's a very efficient metabolic fuel. So if you drink it or consume it while exercising, you'll likely be able to go farther and longer, and it can enhance your performance, probably your cognitive performance too, with time, just your cognitive resilience, if you will. And I find that occasionally I'll go through periods where I'm so busy, I'll really miss a couple nights of sleep, or only get a few hours. But
Right.
if I use the product, I don't miss it. I don't miss a beat. I can stay up late and finish a grant. I don't. Sleep is very important to me, and I think it's important to get proper sleep. But in the events, in the situations where I can't, I find that being in ketosis really helps me.
Yeah, yeah, it does, especially like when you're sitting down at a desk and not really
Yeah,
doing any vigorous exercise. It just
yeah,
means that you've got
absolutely.
access to your body fat, right, for
Yeah,
energy, and you just
yeah,
sort of like you're able to burn through it, and it's fine.
yeah.
I
That's
don't
right.
see what the problem is with this, but some people just seem to have a real
Yeah,
chip on their shoulder about all this. But yeah,
yeah,
I think the message is getting really out there now in the ketogenic diets application about
yeah,
where it can be, and that you can sort of do it almost cyclical, like in a
yeah,
sort of cycle where you
yeah,
do have that metabolic flexibility of being able to burn glucose and being able to use ketones for energy as
yeah,
well. So
yeah.
sort of like having that happy medium almost, but kind of the best place to start is like in like a deep ketosis, and then build yourself back up to be able to sort of go back and forth between the two.
I agree. That's a great approach. And I think that's important too for athletes, because I think if you're sort of keto adapted,
Mm-hmm.
then you can almost view carbohydrates as an alternative fuel when you exercise.
It's funny
You
that.
can kind of throw it in there, but because your body's effectively oxidizing fat for energy, but in the middle of an event or something like that, to prevent depletion of glycogen, you can just kind of titrate in some carbs when you're doing it, or carb backloading is
Yeah.
kind of a pretty common approach. I think can be pretty effective. But I encourage people to experiment with diets and to carefully monitor how they feel, and
Mm-hmm.
look at objective markers of your health, like
Yeah.
your blood profile, your blood glucose, things like that. So I'm a big
Absolutely.
advocate of that, and because everyone's going to respond different, and I think I'm studying. We're getting into studying this now, but there's a difference between males and females, and I
Yeah.
feel that you tell 10 males to go fast, and they for 3 days, and they'll do it, and they'll have pretty impressive numbers. But if you do that with females, you'll have a couple drop out within 24 hours. A
Yeah.
couple will get hypoglycemic and feel faint, and many of
Mm-hmm.
some of them, they just can't adapt to a ketogenic diet as well. And with males, maybe it's an ego thing. It's like, yeah, I can fast, I can do this, and and
Possibly. Yeah.
they want to get through it, and they're proud about it. But I just find that anecdotally, there's many females that are actually thriving, athletes that are thriving on low carb diets, and they do it very
Yeah.
effectively, like paleo type diets. And
Mm-hmm.
but I find in general that males adapt a little bit better, are a little more resilient when it comes to tolerating fasting, and tolerating extreme carbohydrate restriction
Yeah.
required for the ketogenic diet. And I'm actually fascinated with the hormonal effects that change the hormonal profile, how that changes in females relative to males during fasting, and or
Mm-hmm.
during the ketogenic diet. And this is something that we want to study, because most of the
Sounds really
ketogenic
interesting.
diet research in rodents, it's like 90% of it is done in males. Almost all research, probably more than that, 95% of it is done in males, because
Mm.
when you do research, you tend to do males because the estrous cycle in females kind of screws up your results.
Yeah.
And so almost all the data that we have on this diet is really done in males. So it's really important to study the effects of females, and how, for the importance of their female health, how it influences different hormones. Your thyroid too is something that some people have a concern with prolonged carbohydrate restriction.
Yeah.
There's a decrease in T T4 to T3, the active form of thyroid.
Yeah.
There may be some change, although I think it's more relating to calories, but the carbohydrate restriction can potentially influence that. These are things that
Yeah.
have not been firmly studied, but that really need to be studied.
Absolutely. Absolutely. All very important questions. But the most important question, Dom, is what did you have for breakfast this morning?
For breakfast, I had 4 eggs, and I had bacon, organic bacon free of nitrates, and I had
Perfect.
spinach and a little bit of broccoli that were left over from last night. So I'm being fueled by bacon and eggs this morning. And,
Absolutely, ditto.
I ate about, I don't know, 6 hours ago, and I feel like I have a ton of energy. I'm not hungry at all. So that's a good sign that, you know, my body's probably in strong ketosis right now. You know,
no doubt, no doubt. Strong as an ox as well. Strong as an ox as well. Perfect. So people can follow you on Twitter at Dominic D'Agostini2. If you want to see how that's spelt, you can look in the links below this very video, and also they can check out your website ketonutrition.org. Yeah, I think they can check out your academic profile on the University of Florida website, the USF, I think.
Yeah,
it is, isn't it? And I think it's got some of your research on there as well, so people can check that out if they feel like they want to. And also check out your TEDx talk, which is a brilliant 10 minutes that's kind of nice and concise and clear, and sort of showing all of your work in graphical form as well, which is brilliant. So yeah, was there anything else that you wanted to add to that, Dom?
No, I think, you know, thanks for having me. I really appreciate, you know, this platform to talk about my research, and I really appreciate all the research all the information that you bring out to people, and using kind of leveraging your media resources to do that. And I know you're just helping a lot of people, and I really appreciate and admire what you're doing. I just wanted you to know that.
Thanks, Doc. Cheers, man. It means a lot coming from guys like you. You know, you guys are like the forefront of the science of everything that we're trying to sort of like push along. So, yeah, really appreciate you being here today. And yeah, hopefully we'll get you on again very soon, maybe in 6 months' time, once you finish your next lot of research, and sort of we can discuss more results and progress that you've made as well.
Thank you.
Sort of, it does progress over kind of short periods of time. So yeah, fantastic. Awesome. Well, Dom, thanks again for all your time today. If anybody has any questions for Dom, make sure you hit him up on Twitter, and I'm sure he'll get back to you as soon as he can. Cool. All right. And then one last thing to do, Dom, is that we need to smash it out from you. So on 3, you just shout, "Smash it out!" On 1, 2, 3.
Smash it out.
Yeah, there we go. We're trying to get everybody to do it. We had Shane Watson, the Australian cricketer, do that a couple of days ago. He's like the vice captain for the Australian cricket team, and he's following a low carb, high fat diet himself.
Cool.
So yeah, it's pretty cool. But anyway, thanks again, Tom, for your time today. Oh, no worries. And yeah, we'll see you again soon.
Okay, appreciate that. Thanks. Bye-bye.
Bye.